Good afternoon, Community Forum. Thank you for being with us today, June 17th on 3 o'clock with SOC. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes, gracias por estar con nosotros hoy, el 27 de junio en 3 en punto con SOC. Para oír en español, llame al número que aparece en la pantalla, que es 425-436-6200, y el clave para entrar es 627-682. Las versiones en español de los episodios se pueden encontrar aquí en nuestra página de Facebook y también en YouTube. My name is Marisol Diaz, Communications Manager here at SOC. We want to remind you that during this time we haven't missed a day and we're still here for you. You can connect with us by phone at 672-8090, our email, soc@socmilwaukee.org, or visit our website at www.socmilwaukee.org. And of course, you can reach us here on social media, and we have Facebook, Instagram, and LinkedIn. Coming up this week, for tomorrow, we have Claire Evers, who's going to have a COVID-19 segment. And Friday, we have Ches Ordonez, City of Milwaukee Equal Rights Commission on. Now I will turn it over to today's host, Marlene Zaran, who will, she's going to lead us into the discussion for today's show. Hey, Marlene. Your mic, honey.
Hi, everyone. Thank you, Marisol, for that introduction. So today I will be doing some quick critical updates, and then I'll introduce our guest. So for today, we continue in solidarity with protesters, raising awareness to critical issues in our community and with the families who have lost loved ones at the hands of police brutality. And our thoughts and prayers are with those impacted by COVID-19, especially who have the illness currently, and to those who have had someone pass away from COVID-19. In other news, so today there's going to be a virtual town hall hosted by the ACLU that includes SOC, which is a part of the CCC, who's going to be speaking on their panel. The event is called Smart Justice During COVID-19, Police Divestment and Incarceration. So that's going to be happening tonight at 6:30 p.m. So the link is located in the messenger section of the forum. So take the time to come watch that tonight. Another update that I have for you guys is tonight on Telemundo and CBS 58, there's going to be a press release by the CCC this evening in the news, and it's going to include Tammy Rivera, who is also our executive director of SOC. So a new resource for COVID-19, there's also a new resource for COVID-19 testing through the Wisconsin Health Connect website. So if you go to wisconsinhealthconnect.com, you can find a self-assessment tool for COVID-19. Essentially, if you go through that free screening tool, you can complete it on your mobile smartphone or home computer in less than 10 minutes. And then once you complete it, an individualized medical response will happen, which means a registered nurse that's trained to assess and triage your COVID-19 results will contact you directly to answer all of your questions. And it's also confidential and private. So all screened information is kept private and confidential in accordance with HIPAA privacy standards. That being said, for today, I'd like to continuously welcome our guests, and that, we're happy to have you guys here today. We're always looking forward to any questions and any interesting topics that you'd like for us to talk about. So whenever you have time, take the time to leave a message real quickly in the comment section about anything you'd like to learn about or any concern that you have that you see in the community that you feel should be a topic that's spoken about. So since it is Mental Health Week and this is a Mental Health Week forum, we're focusing mainly on mental health, stress, how to cope with stress, how to define stress, how to define mental health. We're here to continue talking about mental health, but today we're going to focus on mental health amongst the Latino AX population in Milwaukee. So today I have with me Gabriela Diéguez, a Latina clinical social worker and mental health provider from 16th Street Clinic. She'll be speaking to us about the impacts of COVID-19 on the Latino OAX population in Milwaukee. Hi, Gabriela. How are you today?
Fine, thank you. Thank you so much for inviting me.
Yeah, of course. We're happy to have you here with us. We know 16th Street Clinic is a valuable resource for the south side of Milwaukee. And we hope to share all of the valuable mental health resources that the facilities currently have for us today. And we're going to break down some mental health impacts on the Latina population, including impacts of social distancing, economically, immigration level. So, and then, we'll talk more about self-care as well. So, my first question for you, Gabriela, is if you could quickly give us a rundown of what 16th Street Clinic does regarding mental health right now, and exactly if individuals can have that accessibility of.
So 16th Street Clinic has had services for mental health for over 25 years. We have a large group of counselors. We have 3 different locations in Milwaukee. On 16th Street and Washington, we have another location on 20th Street and between Cleveland and Oklahoma. And the newest addition is on Layton and 27th. We have counselors that can provide services one-on-one for couples, for families at the 3 sites. And we have day treatment services at the location on 27th and Layton. So the services that we can provide are for counseling, with a counselor like me or a psychologist. And then we also have the possibility of having consultations with a psychiatric nurse practitioner or a psychiatrist, depending on the needed services for the patient. So how do people become a patient at the clinic? You don't need to receive medical services at the clinic in order to access our mental health services. People can access both or one of the services here at the clinic.
Can you talk about, touch base on the demographic of individuals that do come to the clinic?
Sure. Probably our demographics is 80% of the people we serve are Latinx population, but we also serve African American population and refugees and people from other parts of the world that are recent immigrants to Milwaukee.
Wow, that's amazing. It sounds like it's a very good resource for everyone. So my next question for you is, what impacts have you seen affect the Latino OAX population's mental health during COVID-19 restrictions and social distancing?
Okay, so we probably all have heard on the news that the zip codes where the majority of the population is Latino have had very high rates of infection. Zip codes 53204 and 53215. And I think what happens is that in these zip codes, we have a lot of essential workers. Most of our population are working cleaning offices, cleaning hospitals, serving food, and those are essential workers. So we have not had the luxury to say, oh, I'm going to stay home during these 3 months. We have continued to work, so we have had much more exposure to other people. The other thing is that some places where Latinos work have not had enough protections for their workers. I have encountered several um, patients in the clinic that have mentioned, well, I am working at a factory where we do dog food, and we are still too close to each other and we don't have the protection needed. Or people that have been in places where there is not an essential thing, for example, a printing shop for t-shirts, and I've heard, oh, we're still working very close to each other, not enough protection for every worker. And sometimes I heard also that workers were encouraged to continue coming to work even if they were having some symptoms. So I think those are the two reasons. It's very important to have a clear picture of why we're having a higher infection rate. And is not because of something bad that we are doing, is the circumstances of our environment and the need of our community as well.
Yeah, definitely. I agree with you on that. Lots of health disparities and socioeconomic status does affect, anyone's ability to be able to stay home. And that's why a lot of people say it is a privilege to stay home.
Exactly, and that's another reason for having the impact from COVID, that there is a large group of Latinx population that will not be able to receive benefits. So we cannot afford to stay home and collect unemployment and then receive the extra income to support during this pandemic. There's also, I think, a lack of crucial information. One, because of the language barrier, but also the information for the country has been very complex. Once, because the virus is so new that the information has changed in these 3 months. So I think that has been a very difficult thing for everyone to figure out. And I think the other thing in our city and these zip codes has been the challenges with education and the discrepancies between some of the schools, the private schools, and then the public education. So I think that has impacted our families a lot. I've heard parents talk about the delay from some schools in getting enough material for the children, but also the challenges for some families to utilize the resources that the schools were providing. I work with families where the parents don't know enough English to be able to help with homework, and maybe they can help with homework a couple hours a day, but when the demand is to be the teacher every single day for 3 months, they were not able to do it. So we have those disparities for children.
Yeah, exactly. I've heard stories of individuals that have only one laptop at home, and so if there's 3 children at home and they need to get homework and assignments done, it's going to cause a barrier for them to get the knowledge that they need and stay at the educational level. But do you feel there is a lack of is going out into the South Side community regarding education on the impacts of COVID-19? Do you feel there is a lack of fear?
No, I don't think there's lack of fear. I think it's a two ways, because some people, I have talked with some people that are very fearful to the extreme that they had not been going outside, and isolating way too much. And then there's also the other side of people that thought, oh well, this is too difficult to do, so we might as well continue our lives as usual. And I've heard families say, oh, but my neighbors are still having parties on the weekends, and I don't see people using the face mask. So I think it can be very complicated to manage.
Yeah. That being said, since we just touched upon that topic, what are the main mental health impacts you see while working at the state clinic?
So we see a great variety of issues here at the clinic. Depression, anxiety, trauma, and in children, behavioral problems and ADHD. And right now we're seeing a lot of anxiety due to COVID. Families very worried about getting their elderly sick if they become sick, but also children much more aware of what's going on, and then getting worried about small things that in the past would be very, very normalized and now have become a source of anxiety. And in part is because we have access to a lot of information, and then children are not able, and I think adults, we are not able to process 24/7 access to news, and it's not healthy. So then we become hyper alert to information and not with enough resources to be able to calm down and feel well.
I see. How do you think, I'm just throwing a random question at you. How do you think parents should approach COVID-19 and their children? What steps should parents take to help their children's mental health?
So I think it's a couple of things. One is very important that parents talk about what's going on, but to talk about it in a way that is using language appropriate for children. So one way to do it is to make pictures about what's going on, and find out information that is scientific, but put it in very, very simple terms for children. And then it's very important to prioritize the information about how, as a family, we are all protecting each other. So then the children know that the parents are in charge of making sure that they, as a family, are safe, and they are part of the solution of protecting others. So making sure children keep in mind the washing of hands and using the mask to protect others, because this is a very interesting thing about this virus, that when we use the mask, we're protecting the others around us. So it's a very caring way for children to say, well, I'm part of the solution. I'm going to wear my mask when I am outside the house. And actually, for families, when they have had someone ill in the house and they are trying to quarantine to ensure that no one else gets sick, then using the mask and having the precautions to ensure no one else gets sick.
Yeah, that's a really good point. A lot of families don't really know how to approach it, but yeah, that's definitely a great way of thinking about it, to create more of a community. So can you talk to us a little about what different self-care options the Latino AX population can do while they're currently
So in terms of self-care, I think there are a couple of things that are essential. One is to maintain the relationships. So we need to cultivate relationships, because as human beings, that's what really feeds our soul. And I think for Latinx population, we all would say, oh yes, we like to be with each other. We like to celebrate in families, with friends. So cultivating those relationships relationships is essential. What we have to figure out is how do we do it safe now? So we need to use the phone more often. We need to do video calls. And we need to think about how we can do activities outdoors while keeping some distance in order to be safe and protect our family and friends. But that's number one, I think. Then the other one is maintaining schedules, maintaining some regularity, because at this moment there have been a lot of changes and a lot of uncertainty. We don't know for sure how long this is going to last and what's going to be the next step for our city. So being able to have schedules gives us a sense of tranquility and knowing that at least my environment, I know what's coming next, and I can rely on what's going to happen. So the basic schedules of sleep, waking up, meals, and exercise. And I would say that that's the other thing, having a set time of exercise, and best if it's outdoors. So going for a walk in the neighborhood, and yes, use your mask. If you feel that the other person, you don't have enough room to go by another person, cross the street to feel safe. But exercise, use our park systems. We have a beautiful park system, and the safest way to use them is bring a ball, bring a toy that you can share, and then enjoy nature and move.
Yeah, definitely. Being one with nature actually has been proven to help individuals' mental health on a whole other level. It's quite impactful for like the human body, not even just the body, but the human soul, your subconscious. It gives you time to from the city life and all of the stress and be one with yourself. So,
yes, exactly. Yes.
So how can you talk to us about how has COVID-19 impacted the Latinx individuals economically and on an immigration level? I know you did touch base on that. We did talk about how there's a lack of resources and the fact that essential workers in our community still need to go out and work because they don't have the privilege of staying home. Is there anything else you'd like to touch on that regarding economic distress and immigration distress during this time?
Well, I think the important point is how families that are mixed in regards to their immigration status have not been able to benefit at all. So one of the things was that benefits will be excluded for families that who had combined immigration status, even within a family. So that's a big stressor for families. We've had in the community groups come up with ways of helping each other, and that has been an inspirational thing to observe, not only from formal organizations but also from grassroots organizations. And there's also been a very harsh rhetoric in regards to immigration. I think that, for example, in regards to the workers at meat factories, a large number of workers in meat factories are Latinx population. So when we don't think about their well-being first, we're giving a message that is very demeaning to the population. They, of course, food is an essential product for the sustainability of our community. But if our food producers are ill, we also need to figure out how do we protect them, and how do we make sure that they can continue working safely. So it's not about calling them heroes, it's about making sure that they are protected and that they can continue doing their work in a safe way.
I completely agree with you on that. And there's also that fear of even going to work every day, knowing that bring COVID-19 back home to your family.
Exactly. And that can be very distressing, emotionally distressing for families to wonder if they are bringing back home the virus with them. Mm-hmm. And it is a reality, because it is a virus that can be shared with another person while not having symptoms. It is very difficult for people to know, am I a carrier or not? And then the distress for families, when a lot of families in our Latinx community are multi-generational. So we might have very elderly people in the same household, and the elderly are at a higher risk. So then figuring out how to protect the family becomes another stressor that adds to everything else.
Mm-hmm. I completely agree with you on that. Can you give us some examples of behavioral health resources that people can utilize from 16th Street Clinic?
Yes, so at the clinic we have counseling services, and in the past, before COVID, we also have had groups. So we have a group for girls that meets throughout the school year, and we're hoping that as soon as we have a plan of how we can do meetings in groups, that we will be able to go back to having this group. We also have day treatment services, and day treatment is a service of more services within a day. We have day treatment for children, so children will spend half of the day here at the clinic with counselors, and other children that have specific goals in terms of their behavior or how they are managing their emotions. And then they would go the other half of the day to school. So right now, even though we are not meeting face to face, we are using telehealth, and we are able to service in small groups some of the children, like the education system has done as well.
Can you explain to the public or the audience currently watching, how does the telehealth counseling process work?
So how it works is the person usually receives a call from the counselor. For example, I would call my 4:00 patient and say, "Hello, this is Gabriela. Are you ready for our appointment?" And then they'll say, "Yes, you can send me a text." And I will send a text to their phone number, and they accept the video call. And this is a service that is following all the procedures in regards to confidentiality. Mm-hmm. So it's a specific service. Some people might say, "Oh, you can call me via WhatsApp," but that's not secure enough. So we use a special service, and then the video call takes place in that way. So the person can do it over the phone, over a tablet, or some people prefer to use a computer. So the three of those will work fine.
Mm-hmm. And that protects individuals' confidentiality relating to, fear of, showing their identity, presenting their identity due to like immigration.
Yes, then we can assure that the visit is confidential. No information is being shared, and their information is protected. Yes.
All right. Well, you heard it from Gabriela. She is the inside scoop for the 16th Street Clinic. Please, you reach out to 16th Street Clinic if you have any current distress that's happening in your life right now and you need someone to speak to. Sometimes family or even friends is just not enough. We just need someone to talk to on a one-on-one basis, and get some advice from them or get some guidance. And they're very understanding, and counselors are always willing to help. I myself have gone to mental health counseling sessions when I was in graduate school, and it really helped me throughout the whole entire process. So I can guarantee that it was helpful either if you feel like it might be, or if you feel like it won't, it's gonna get you somewhere. Yeah. So thank you, Gabriela. Thank you for your time. We appreciate it so much. We have the 16th Street Clinic information on locations and their phone number, and including their behavioral health link in the messenger comments section. So please feel free to contact them whenever you guys want. Thank you so much for your time. Thank you for being with us today.
Thank you so much, Marlene. It was a pleasure.
Thank you. Thanks. So now we're going to have our SOC feature for today, and it's going to be hosted by one of our coworkers. Her name is Gabriela Diéguez, and she's going to talk to us about the gold graduation ceremony that happened through our grassroots SOC organization.
Hello, everyone.
Hi.
Hi, thanks for having me on today.
For sure.
So I'm going to be talking about our gold graduation that we just had this last Saturday, June 13th. And I am from my patio right now, so I'm getting my vitamin D and doing that self-care. That was such a great piece of advice that we got earlier in the show, so thank you for that. We did have our graduation, like I said, last Saturday, June 13th. We graduated a bunch of resident fellows, also some youth leaders, and also our staff. They went through 12 months of training, working on grassroots organizing. And if we can just show our curriculum, I'll show you a quick overview. But I love our Grassroots Organizing Leadership Development Institute so much because we are very holistic. And in our holistic plan, we do work on personalized leadership, residential leadership, and also grassroots organizing leadership. In our personalized leadership, we always talk about that self-care and wellness. It's always important for new organizers, our residents, to understand that they need to make sure that they're caring for self before they can care for their community. And that's something that we guide them through and walk them through every session. In our monthly sessions, we'll also connect them to their nearest resident association. And Southside Organizing Center helps with a coalition amongst all the resident associations. So then we can help each other with cross-promoting events. We can help with outreach. We can help with volunteers, and also giving some amazing experiences for our youth organizers. And then we have our grassroots organizing curriculum. In our grassroots organizing curriculum, we're doing a lot of overview about the history and power struggles happening in Milwaukee. And we have a number of amazing legacy leaders, many that you've already seen on the forum. Dr. Tony Baez. We've also had a number of elected officials. We've also had Reggie Jackson on there, and just numerous ones we've been lucky to have. And they will be coming back for cohort 2 to do our sessions then. And that's sure for showing the curriculum yet. But I know in a moment we're going to go through some great photos of our graduation. We were very lucky to have 2 amazing guest speakers. They were Alderwoman Zamaripa. She was there to give a recommendation, and she's also giving a letter of congratulations to our graduates. We also had County Supervisor Sylvia Ortiz Velez. She was on there as well to give congratulations. And then we had a wonderful letter of condemnation from the Wisconsin state legislator that State Representative Gabriela was able to get for us, and she gave us well wishes, as well as a letter of congratulations for Alderman Perez, who has also been an incredible supporter of the Gold Institute since its beginning. We're right now just finished cohort 1. We did a pilot year the year before, and we're going into cohort 2. So it's been incredible, and we're getting better every year. So I'm very lucky. I know we have a couple of photos coming through, and I apologize that I can't see them on my end. But besides that, unless you had any questions, oh, here comes our slideshow. I'll let it play for a moment. And thank you to our incredible Marisol for putting this together for us. You can see some of the wild training that we've done. 12 months of work, monthly sessions, a lot of dedication. Our youth workers doing outreach for us working at neighborhood groups and making sure that we're finding great nominees. It's been an incredible turnout every session. This is from our grassroots organizing conference that we had. We'll be having another one soon. And just, yeah, a lot of incredible work from our cohort. And as we're adding up, I just want to add in, going forward to cohort 2, we're doing interviews with our current nominees. If you have a group that is on the South Side and you feel like you could use some leadership development, or you want to partake in your resident group more, please don't hesitate to reach out to SOC. We can help you here. You can also reach out to me directly at gold@socmilwaukee.org if you're interested in having a personalized workshop for our leadership development. But we'll be starting online in June, very excited. And we're always looking at improving our programming and making sure that we're offering a lot of great resources for the residents in our district. So I think that's all I have right now, unless there's any questions or follow up with you all.
No, that's amazing. Such great work, and congratulations to all the graduates and for all of their community grassroots organizing work that they've been doing. I know they've been quite hard at work this past year.
Yeah, and can I also add on that, being in a pandemic, while it can feel a lot of fear and a lot of worry right now, it's also increased a lot of residents wanting to really take charge and helping their neighborhood. So we've had so many great people coming through and asking, how can we have this program on other sides of Milwaukee? How can we, be a part of Gold? How can we do these workshops? And we're always here to help you. Please reach out at any time.
Yeah, and is there a way people can join, or any new individuals who are interested?
Yes, this particular program, it's for developing leaders. So we want someone that has a little bit of experience and is ready to commit. Really, it's I would say about 2 hours a week of work that we'll be doing some online, and when it's safe, we'll be meeting together, because that's really where the collaboration of the magic of collaboration happens, when we're together.
Mm-hmm.
And we guide them through strategic action planning and seeing their resident needs and dream and making them a reality. And every cohort, they stay a part of the coalition. So this year they might be a fellow, but next year they might be a coach. And as long as they're living on the South Side, they can be a part of the program, and helps us get stronger every year. So, and again, reach out to gold@socmilwaukee.org if you want more information, or if you want a personalized workshop. We're here to help you.
Thank you, Andrea. Yeah, so if you're interested, I know that the program has a lot of benefits, and it really helps you build community, build connections on the South Side of Milwaukee within grassroots organizing. So I also want to give a disclaimer that the views and opinions shared today do not necessarily reflect those of SOC. Just wanted to let you guys know that, and I'm happy to take any questions or comments from our guests at this time. So our next part of the segment is going to be our promo for this week, and our promo is a Pledge for Grandpa promo. So please pledge to keep Grandpa safe from COVID-19 by sharing your grandfather's photos to be featured in our Father's Day slideshow. Please have everything. Please send in your photos by June 19th. And once you hand in your photo of your grandpa, we will put it in a raffle, and we'll pick one out, and you can win a $50 gift card. So by pledging to do this, it's to help keep your grandparents safe during this time regarding social distancing and protecting them from COVID-19. Our next part of the segment now will be our thank yous. So again, anything coming up for the week is we're going to have Claire Evers on the show tomorrow, and she's going to give us a COVID-19 update. And then Friday, we're going to have Ches Ordonez. He sees the City of Milwaukee Equal Rights. He works for the City of Milwaukee Equal Rights Commission. And we're happy to have these individuals on our forum for tomorrow. Again, we're glad to have you individuals as our guests and continuously participating in our forum. We're very happy and blessed by your dedication. And now we will play our thank yous for the week and for today.
Hello, SOC viewers. My name is Jordan, and I am a member of SOC's Gold Institute. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our SOC survey. In addition to thanking our residents for tuning in and sharing our show, we would also like to thank the following sponsors: Wisconsin Voices, Community Development Block Grants, NEO Philanthropy State Infrastructure Fund, Movement Voter Project, Catholic Campaign for Human Development, Zilber Foundation, City of Milwaukee Office of Violence Prevention, Tides Foundation, City of Milwaukee Promise Zones, and all the faithful individuals who support SOC through their personal donations. Thank you.